The pathophysiology of venous disease are patients with venous insufficiency when they're symptomatic. This is more of a chronic type condition. The patients experience these complaints for years and years. It takes years to develop. There's two primary sources, the primary varicose veins and then the secondary varicose veins. The primary varicose veins develop in the absence of DVT and have incompetent valves in our common femoral vein and in the saphenous veins. And it's possible the valves are just absent. And then the secondary varicose veins usually result secondary to DVT. And the incompetent valves within the superficial and deep system, and possibly even the perforators, allow the blood to move back down towards the leg, towards the feet, increasing the venous pressure. There can also be possible residual thrombus along the wall of the superficial system or the deep system that would prevent blood from moving back in its normal pattern towards the heart. This disruption of flow with the incompetent valves just allows blood to flow in a circular type motion between the superficial and the perforators and the deep and the perforator and the superficial. It's just a very inefficient method to return blood back to the heart. And through this method, it just continues to increase the venous pressure in our lower legs. The most common type of venous insufficiency is the primary type. It accounts for 64 to 79% of our patients that suffer from venous insufficiency. It is that of the primary form. The secondary type, the secondary, remember, is related to DVT. That accounts for about 18 to 28% of the patients that have venous insufficiency. Varicose veins have a prevalence of up to 60% in women and about 56% in men, and it's usually affecting people over the age of 50. It's a progressive chronic type disease process, and it tends to be a little bit more common in women than in men. And just to kind of take a look at this image here, this valve, this is where their coacting valves are very delicate, but their function is so important. They're preventing, again, or they're preventing this blood from coming back down towards the leg and increasing this overall venous pressure. When they're not functioning correctly, the flow is disruptive, and it eventually weakens the wall, and the vein wall becomes dilated and tortuous, and the veins become gnarly with the disruptive flow secondary to that increased venous pressure.